Project 7A, Natural Birth Simulation, Forceps-Assisted Delivery. The project requirements and preparations are the same as those for Project 6A, with the addition of a pair of miniature obstetric forceps available online. Before starting this project, familiarize yourself with the fetal stations.
It will be assumed that labor has stalled with the fetal head at station +2, and that all attempts to further progress labor have been unsuccessful.
The assistant will use their dominant hand to apply controlled pressure to the balloon inside the box to simulate the baby's descent through the birth canal, but should stop short of crowning. While applying pressure with their dominant hand, the assistant should use their non-dominant hand to locate the baby's ears through the balloon, then position their index finger and thumb just above them to simulate the mother's ischial spines. At this point, the obstetrician can perform a quick vaginal exam and simulate determining the fetal station by inserting 2 lubricated fingers into the vaginal canal and locating the fetal head in relation to the ischial spines. Confirm that the fetal head has passed the ischial spines and that the station is at +2.
Once complete, the assistant can remove their non-dominant hand from the box, but should continue to apply counterpressure throughout the forceps-assisted delivery to prevent the tiny baby from being pushed back into the uterus balloon.
The obstetrician will now use a pair of obstetric forceps to complete the delivery. First, lubricate the blades of the obstetric forceps and unclip them. Insert the left blade with the left hand, guiding it between the fetal head and the vaginal wall using the index and middle fingers of the right hand. Ask the L&D nurse to hold the left blade while inserting the right blade with the right hand, guiding it between the fetal head and the vaginal wall. Lock the obstetric forceps in place and avoid pulling on the head between contractions. The assistant will mimic contractions by varying the amount of pressure applied to the balloon while the obstetrician applies a pulling force in an upward J-shaped line during contractions. The assistant must make sure to hold on to the placenta inside the balloon until after the umbilical cord is clamped and cut. Once the baby's head is free of the birth canal, the obstetrician will remove the obstetric forceps and deliver the rest of the baby. If there are no signs of distress, the baby will be placed onto the mother's chest and covered with a blanket for skin-to-skin contact.